à tous. Thank you for joining us. Merci d'être parmi nous aujourd'hui. We are here today to provide an update on the City of Ottawa's response to the COVID-19 pandemic. Nous sommes ici aujourd'hui pour vous fournir une mise à jour sur les mesures prises par la Ville d'Ottawa pour faire face à la pandémie de COVID-19. My name is Ian Miller and I will be your moderator. Je m'appelle Ian Miller et je serai votre modérateur pour aujourd'hui. Before we begin, a reminder to place your microphone or audio on mute until I invite you to ask a question. Avant de commencer, j'aimerais vous rappeler de désactiver votre microphone jusqu'à ce que je vous invite à poser votre question. Today we will be hearing opening remarks from Dr. Vera Etches, Chief Medical Officer of Health, médecin-chef en santé publique, followed by Dr. Doug Manuel, Senior Scientist with the Clinical Epidemiology Program at the Ottawa Hospital Research Institute, clinicienne principal pour le programme d'épidémiologie clinique à l'Institut de recherche de l'hôpital à Ottawa. And Dan Chenier, General Manager, Recreation, Cultural and Facility Services, Directeur général des loisirs, de la culture et des installations. Available for questions from the media following the statements, we also have on the line, disponible pour répondre aux questions des médias, nous accueillons aussi Alison Sander, Public Information Officer for Bylaw and Regulatory Services, agent d'information au public, service des règlements municipaux. After we hear from the panelists, we will take questions from the media. So we'll begin now with remarks from Dr. Vera Etches.
So at the end of this first week of reopening, as the warmer weather appears to be here to stay, many people would perhaps be feeling like we've entered a new phase of the pandemic, and they would be correct. And now is not the time to ease up on our efforts that have been keeping this virus pinned down. So we're still learning how we can live with COVID-19 in our community while we start to enjoy some of the activities that we have been missing. I can't say enough that we must continue to keep physical distancing and wear a cloth mask in situations where we can't keep a 2-meter distance from others outside our household. These activities prevent infections. We're still in this as a community to protect ourselves and others. Je ne dirai jamais assez que l'on doit continuer à respecter la distanciation physique et porter un masque en tissu dans les situations où on ne peut pas maintenir une distance de 2 mètres par rapport aux autres personnes hors de notre foyer. Nous sommes toujours tous concernés comme communauté et nous devons nous protéger les uns les autres. So as we resume our usual activities and routines like shopping or grabbing a takeout coffee, perhaps you're seeing others we have not seen in a long time at that 2-meter distance. You may experience a variety of emotions. And I, for one, did get a little emotional yesterday when I saw the person who I usually see at the coffee shop down the street when it reopened after 2 months. So this is normal during times of stress and uncertainty and when we see signs that people are overcoming adversity. So thank you so much for your efforts in the first phase of the pandemic response and for your resiliency to continue this hard work and continue sharing ideas about how we can live with COVID-19. I want to speak about testing. It's a hot topic as usual, and our testing strategy continues to evolve. Testing to detect COVID-19 infections in our community is one of the other efforts that will help us keep this virus pinned down as we begin to reopen. And I'd like to remind everyone that testing is now available to anybody in the community, any age, mild symptoms or not, severe symptoms, a cough, a sore throat, a fever. These are signs that we would like you to present for an evaluation and COVID-19 testing. Many family physicians' offices are now open, so check with them first. But you can go to the assessment center, the care clinics. The laboratories have the capacity to offer and process this testing for everyone that needs it. J'aimerais rappeler à tous que le dépistage est maintenant ouvert à toute personne soupçonnée d'avoir la COVID-19. De nombreux bureaux de médecins de famille sont ouverts, alors veuillez vérifier auprès d'un infirmier. Le centre d'évaluation, les cliniques de soins et les laboratoires ont la capacité d'offrir ces dépistages à toute personne qui en a besoin. So by getting tested, you are helping us find every case we can to stop transmission of COVID-19. This information helps us detect cases more quickly, understand where transmission is occurring in the community, and investigate potential sources or identify outbreaks earlier. The testing strategy continues to evolve based on the needs of our community, our testing capacity, and provincial guidance. So currently discussions are underway about in what situation it makes sense to test people who are asymptomatic. We currently test people who are asymptomatic in situations of outbreaks in congregate care settings. And Ottawa's testing capacity has grown significantly since the declaration of the virus in Canada, but we still do not have the capacity to test everybody in Ottawa. So we're working closely with our healthcare, our provincial, and our federal partners to best use the testing capacity that we have. We encourage employers and organizations to consider using a screening questionnaire. It's available on our website that your staff and volunteers can use on a daily basis to self-assess for COVID-19 symptoms before starting their workday. Any employees with even mild symptoms should not work when they're ill, and they're strongly encouraged to present for testing. Nous encourageons les employeurs et les organismes à envisager d'utiliser le questionnaire de dépistage disponible sur notre site web que le personnel et leurs bénévoles peuvent utiliser pour s'auto-évaluer et détecter tous symptômes de la COVID-19 avant de commencer leur journée de travail. Et s'il y a des symptômes, d'aller faire une évaluation et peut-être un dépistage. So I know testing gets a lot of attention, but prevention is essential, and it has always been a key focus of our work in public health. We would much rather prevent cases of COVID-19 in our community than chase down the virus once it starts spreading. We know that prevention saves the healthcare system money, but it also saves lives. Not getting sick in the first place is better for everyone, particularly when there is no effective cure for the infection. La prévention est essentielle et a toujours été une priorité pour le travail en santé publique. Nous aimerions mieux prévenir les cas de la COVID-19 dans notre communauté plutôt que de traquer le virus une fois qu'il commence à se propager. Nous savons que la prévention permet au réseau de la santé d'économiser les dollars, mais elle sauve aussi des vies. So early public health advice to practice physical distancing has prevented transmission of the virus in our community. And again, I thank you as you continue to practice these preventive measures, like washing your hands frequently, not touching your face, and wearing a cloth mask when you're in close contact with others outside your household. Testing is not enough. These measures are important to continue to limit transmission in the community. Connecting with people with confirmed COVID-19 and their contacts to support them to do their part to manage their illness and decrease further transmission is another essential public health measure in place to help keep the virus pinned down as we reopen Ottawa. When Ottawa Public Health is notified of a confirmed case of COVID-19, we call the individual within 24 hours and we begin the process of contact tracing. Through our case and contact management work, Ottawa Public Health is seeing that the number of close contacts per case is now often less than 5, and contacts are usually household contacts. Before physical distancing and self-isolation measures were introduced, Ottawa Public Health was notifying approximately 15 to 20 close contacts per case. So we'll continue to monitor this impact of reopening and how this influences the number of close contacts per case. And as Dr. Doug Manuel will discuss, modeling shows that in Ottawa, if contacts rise by even 20%, we can anticipate to see hospitalizations increase. Nous continuons de surveiller l'impact du déconfinement et l'influence qu'il exerce sur le nombre de contacts étroits par cas. Comme le Dr. Manuel en discutera, la modélisation indique qu'à Ottawa, si les contacts augmentent de seulement 20%, on peut s'attendre à une augmentation des hospitalisations. So I encourage everyone To get outside, enjoy this beautiful weather, please keep doing what you're doing to limit your total contacts. Stay 2 meters apart, wash your hands, wear a cloth mask when you can't keep your physical distance. Your actions are appreciated, and they'll be what allows us to live in a more sustainable way into the future. Merci beaucoup.
Thank you, Dr. We'll now hear from Dr. Doug Manuel.
Mute. There we go. Hi, I'm Doug Manuel. I'm a senior scientist at the Ottawa Hospital and leading some of the projections in collaboration with Ottawa Public Health and the Ottawa Hospital. I'd like to cover 3 topics related to the projections. First, some good news about progress for flattening, some cautionary notes, as Vera mentioned, about moving forward and what the projections tell us about moving forward. And I'm happy to answer questions about second wave. It's a term that I don't use myself, but I know it's on the mind of many folks this week and these weeks. And I'd like to spend just a little bit of time talking about a little bit about the math, or how we make the projections and how we've been designing these projections for the past, I think, 6 weeks or so for this second wave, this potential for the second wave, and our take on the projections here, how we design the projections in Ottawa. So first, I think there's good news. There's right now, as far as I know, it's 2 people in Ottawa Hospital's intensive care unit. This is down from 23 about 5 weeks ago. So we've seen a slight decrease in hospitalizations, downward trend, and we're projecting that to continue. But we've seen a real steady decrease in ICU admissions, and projecting forward down for that, and as well deaths. You know, we've had a lot of deaths, mostly related to long-term care, and now we're seeing these deaths decrease. So I think that's really good news, and I think it's really a testament to everyone. This was everyone in Ottawa who have now flattened the curve. So that's the first part. From these we are projecting, if things maintain the way they are today, we would project a gradual reduction in hospitalizations and a more pronounced reduction in severe cases. So pat in the back, well done. Now the cautionary note. It's very, very tenuous, I sort of say that we've earned ourselves maybe about 10% credit from the physical distancing that we've done. So it's not very much. And as we reopen, we're going to see pressure on that on that credit. We're going to be potentially spending that credit as we're out and about more often. And I think we just have to be so smart with how we use that credit. If we don't, we see all the models, not only ours, all the models see a very pronounced increase in hospitalizations and cases. And it's this difference between a slight decrease and a slight increase. But because the growth potential of COVID is so dramatic, with so many people still susceptible and COVID ability to spread quickly, we are really at this risk of this second wave. Now, I want to stress, the second wave doesn't need to happen. And again, we were able to flatten the first wave. And for that reason, I'm very optimistic that we're never going to see a second wave. But it's really up to us. It's up to us how well we maintain our physical distancing, or I think I like to kind of introduce another term about sort of being smart about how we reopen, or smart about how we physical distance. So so for the same reasons we saw a really pronounced reduction in projected cases from this first wave, the second wave is not at all inevitable. That I think we have the potential to manage COVID. But that said, I think just the restating that we have still a lot of susceptible people and a lot of potential for growth. And any reduction in physical distancing is going to have, or has the potential for increased cases. So for the third part, what does this mean for the science of the projections and the spread? So one thing that concerns a lot of folks, and that how we've designed the projections, is to see how many cases of vulnerable people happen as we recirculate, as we start to slowly reopen. So what I mean by that is that so far we've done really well. We've had a faster reduction in ICU cases than cases in the community. So that's, to me, says that we have this potential, that we've had the people that have the most potential harm, are being protected fairly well. And when we look at how we know that in the model, the main part of the model that we calculate is how often someone who's infected with COVID comes in contact with another person. And the connection is this transmissibility, how transmissible COVID is. And we think of transmissibility not only in the entire population, but those who are most vulnerable to adverse events. And that's what we focus on in the Ottawa Hospital, where we've projected on hospitalizations, and we project hospitalizations. So, I think that what this means for the sort of smart distancing, there's two parts. You have someone who's infected and someone who could end up in hospital. And it's important to remember that when you're infected, you may not know it. 40% of transmission is happening before you have symptoms. So you can't assume, number one, that you might not be infected. And the second part, you can't assume who you're in contact with isn't a vulnerable person. We know that older people and people with chronic conditions have higher risk, but there's many people that may be on immunosuppressant drugs or other things that make them vulnerable. And so when we're going out and being active, you're keeping your distance. And when you can't, you got to remember that you might still be infected. So this is why the Ottawa Public Health is recommending masks, hand washing, and everything that we know. As well, you can't assume that the person that you're talking with isn't at high risk of having an adverse event if they do become ill. So I think that's a bit of the science behind the projections that we've been doing, and I'll stop there.
It's our media.
Thank
There
you.
you go.
Thank you, Dr. Emmanuel. We will now move on to Mr. Dan Chenier.
Sorry, unmuting myself. Good afternoon, everyone. Bon après-midi, tout le monde. As both doctors have mentioned, we're on the Friday before a weekend where weather promises to be very nice. Since Tuesday's relaxing of restrictions on parks, a lot of people have told us that they're interested in getting out into the parks and making greater use of the amenities that are there with the restrictions. But at the same time, we've also received quite a few questions about what is open and what is not. And so this is the opportunity really to talk to you a little bit about the province has relaxed restrictions on many of the park amenities, especially around sports fields and around courts and benches. La province a allégé les restrictions liées à de nombreuses installations de parcs, notamment en ce qui a trait aux terrains de sport, aux bancs et aux parcs pour les chiens clôturés. Toutefois, malgré l'assouplissement de ces restrictions, la province interdit toujours le rassemblement de plus de 5 personnes. The province's restrictions on gatherings of more than 5 people are still in place. They still apply to parks. And so when it comes to basketball courts, football fields, soccer fields, ball diamonds, only casual use is permitted at this time. We can imagine that families can go out and toss a ball, kick a ball, do some physical activity that gets them out and makes use of these amenities, but does not take it to the point of team competitions or gatherings of more than 5 people. The basketball courts are now open, so you can go and shoot hoops, for example. but restrictions on a full team and back and forth competition, it's still too early for that. We're not at that point. Les terrains de basketball sont ouverts désormais afin que vous puissiez pratiquer vos lancers, mais compte tenu des restrictions concernant le rassemblement, la formation d'équipe ou de groupe est interdite. With physical distancing requirements that have been made clear by the previous preventers, you're not able to maintain a 2-meter distance if you are playing full-out soccer, football, or basketball. For this reason, we're not renting out facilities for competitive play at this time, and we're really only encouraging casual use with a limited number of people on the courts or the sports fields at any time. Skate parks and BMX trails are also open with the same physical restrictions and physical distancing requirements that have been mentioned. Municipal docks, a question that we received since early this spring, are now open, as are the boat launches. The seasonal docks are in the process of being put back into the rivers. Most of them are in, with the exception of Echolands, Constance Bay, and Penny's Point, and these will be done by next week. Also happy to report that the fenced dog parks are now open. The gates have been unlocked and people are able to bring their dogs to those. Again, because they are enclosures, we encourage people to maintain the distances. Tennis and pickleball courts are now also open. Tennis nets, the installation of tennis nets started this past Tuesday, and by next Monday, all 285 courts across the city should have had their tennis nets installed so that people can fully use them. Again, we're recommending physical distancing as people play on the courts. Because public health has said that playing any game, you want to avoid touching your face, touching other people's sports equipment like racquetballs, skateboards, water bottles, and bags. It's important that these conditions be maintained. An interesting example that Tennis Canada has issued this week to play with tennis, and we know with the courts opening that will be popular. They provided the useful tip of using that each player use a different colored tennis ball, and that each player only touch their color when they're playing, so that you avoid cross-contamination that way. And when you finish playing, of course, wash your hands, soap, water, sanitizers, all of those things apply since you are in a park and touching surfaces that are touched by many others. The relaxing of park restrictions also allows for the use of park benches and picnic tables and gazebos. Cet assouplissement des restrictions visant les parcs permet également l'utilisation des bancs, des tables de pique-nique et des kiosques. And remember, from a hygiene and health perspective, these surfaces are high touch points. So when you're using these amenities, again, avoid putting your hands anywhere near your face and be sure to wash your hands. The enclosed off-leash dog parks are open, but the gates and often the multiple gates for the leashing areas are high-touch surfaces, and you should really try to minimize the amount of touch points that you put your hands on at these places. You can also walk your dog in parks in the green spaces that are provided, as long as you follow the park designations. Every park in the city is designated as either allowing dogs, dogs on leash, or not dogs allowed. Where you are allowed to walk your dogs, that is now fully permissible. But when you're in the park, of course, keep your distances, maintain control of your dog at all times. You can check the map on ottawa.ca to see the dog walking designation for the parks in your neighborhood. Play structures, swings, slides, and outdoor fitness equipment, including the wading pools and splash pads, remain closed until the later stages. And I want to emphasize this because we're seeing a lot of kids in parks using the play structures. It's probably one of the things that's probably most noticeable in parks, that people are not listening to that. Les structures de jeu, les balançoires, les glissades, les installations de conditionnement physique de plein air, notamment les pataugeoires et les aires de jeu, restent fermées jusqu'à une étape ultérieure du plan de confinement de la province. Nous espérons que l'allègement des restrictions vous permettra d'évader, de vous détendre, avec cette semaine passée à la maison. We hope that some of these relaxed restrictions will provide some escape and enjoyment for your weekend. It's hoped that it's also noted that our bylaw officers are conducting regular, on average, more than 200 proactive patrols of parks across the city. Yesterday, May 21st, a total of 33 verbal warnings were issued to park users, including 9 in Christina Kiss Park and 5 in Walter Baker Park. Total number of COVID-related requests for service to bylaw from the beginning of April until now stand at 5,700, and total number of provincial offense charges at 124. As well, our 6 park ambassador teams continue to visit parks every day, averaging about 35 parks per day. The ambassadors are providing friendly reminders on physical distancing, on the use of and of course on the restrictions that remain with respect to play structures, slide swings, and other things. The ambassadors have been well received by residents and have been able to provide some friendly discussion and hand out some information on both COVID-19, but also on other health services that are available in the city. While we have a promising trend in local cases for COVID-19, the community spread remains high across the city, and so does the risk. When you're in the park this weekend, please follow gathering restrictions and practice physical distancing. Strongly encourage you to only participate in activities with members of your household to help stop the spread. Have fun, but let's do our part to keep down the spread and avoid a second wave. Amusons-nous, mais n'oublions pas que de faire notre part pour freiner la propagation, éviter une deuxième vague. Thank you. Merci beaucoup.
Thank you, Dan. I will now invite questions from each media agency by alphabetical order. You may ask one question with one follow-up. Nous allons maintenant répondre aux questions de chaque organisme par ordre alphabétique. Vous pouvez poser une question et une question de suivi. Again, I remind you to remain on mute until I invite you to ask your question. We'll start with Chris Curries from 1310 News.
Good afternoon. This question would be for Dr. Etches. So we've been hearing all week from the province that testing in Ontario has been lagging. How would you characterize the testing here in Ottawa?
What I'd like to highlight is that the testing has evolved throughout this pandemic, and the strategy will continue to evolve because we've had different objectives for the testing and different capacity over time. So initially we had to find out if it was here, test travelers. Then we needed to make sure our healthcare workers and our hospitals were protected, and our capacity's grown so that for a week now, we've been able, or more than a week, we've been able to advertise to everyone in the population. Please, nothing is stopping you now. If you have any symptoms like a sore throat, a cough, a fever, you feel sick, you think you have a cold, to come forward and please present yourself for evaluation and testing for COVID-19. We don't usually do this. It's usually good advice to stay home when you're sick. Don't go out to see your doctor, just manage a cold, right? That's our typical advice. So we're asking people to change what they would normally do and to present for testing so that we can find cases and we can do the follow-up that we want to do. You know, it's important right now that we have this testing capacity to use it in the best way possible. So we want to find people who have symptoms for sure. We also want to protect populations where the risk is higher of having an outbreak or having serious outcomes like severe illness and death. And so this is the kind of work we're doing with our healthcare partners to think about in situations of higher risk. May we even test those who are asymptomatic, as we do in congregate care settings when there's an outbreak. What we can see into the future is this testing strategy will evolve as our lab capacity grows even further, and maybe as our lab tests become even easier to access and use. So people may be having trouble getting out to an assessment center. If they have symptoms, please reach out to your family doctor's offices. Many are open across the city. There are mobile services that we're operating. So Inner City Health has a mobile COVID-19 testing service to get out to people who have trouble otherwise accessing service. So we're going to announce further things into the future, different ways of trying to get out to where people are, as well as encouraging people to come to our existing centers. We can imagine the ease of testing if we had a saliva-based test. These are things we're looking forward to. So we'll continue to evolve the testing strategy along the lines of capacity and the objectives we have. The stage we're in now is to try to find every case that we can and to do that contact management, case and contact management.
And just to follow up, so you mentioned that we might start testing asymptomatic people. You mentioned in the future, is there any kind of timeline? What capacities would be needed that we can start doing that? Because obviously we can't just have everyone in Ottawa come in one day to get tested. So what kind of capacities would be needed compared to where we are now?
We need to have the right infrastructure to prioritize access to such testing. And so what we've done so far, and this is underway, actually we're not waiting for anything. We've tested asymptomatic people in long-term care homes. We're moving on right now. We've done 2 shelters this week, retirement homes. I think we have another 15 facilities on the list to go. So it's about prioritizing based on risk of the setting, that people are more vulnerable or there's higher risk of infection transmission. So this is in progress. What we're interested in is continuing to work with partners where there's other strategies, questions raised about as we start up our healthcare system. And healthcare workers are returning to work in hospitals when they have been in long-term care homes. Are these other kinds of settings where we would want to do the asymptomatic testing? There's a lot of questions, right? You can imagine, what does one test on one day mean? What can you say to that healthcare worker who's returning to a hospital from a long-term care home if you're negative on one day about the possibility of being positive the next day if you're still incubating something? So there's a lot of nuance around the meaning of a negative test in somebody who's asymptomatic, because somebody could still be incubating the virus or exposed on a following day. So I think what I need to emphasize for everyone is, if you have symptoms, please present for testing. It is clear that we have the capacity to manage that, and we want to see you. And it is a culture change. We want to hear if people are experiencing barriers to getting to the tests, and we'll continue to adapt.
Thank you.
And Natalia Goodwin from CBC.
Hi there. My first question is for Dr. Etches. As we see Quebec loosening more restrictions, allowing people to gather in 10 or more now outside, people here in the Ottawa region may be tempted to go across the river to see family and friends. What would your recommendation be about that? And is there worries about people doing that and then coming back into this community?
My recommendation to everyone is to continue to do what you've been doing in prioritizing caution and care for others. The more we interact with other people, the more the chance that we're going to contribute to transmission of virus in our community still. We know that sometimes we're infected, we don't have symptoms, we don't feel that ill, or we haven't felt, we're not sick yet. And in those 48 hours before we feel sick enough to realize it, the virus can be transmitted to others. And so, keeping that in mind. And so if we are to visit, to keep our distance physically from others, so that we're not in a place where that virus could be passed on if it's present.
Okay, thank you. And I'm not sure if this would be you or maybe our bylaw representative to answer this. That going around some of the parks now that restrictions have been lifted, the signs are still up saying walk through only. Are those deliberately being kept up, or is it just a administrative thing? Will they be changed? I'm just thinking of, people that may not read the news or newcomers that may not have access, that kind of thing.
Thanks for the question. Yes, there are about 5,000 signs out there, so they will be taken down. We are starting to do that. Up until Tuesday's restrictions, we were leaving them up as a reminder that most of the amenities in the park were still closed. But as we start to open up, we will start to remove them as crews go to the park to conduct maintenance and
And will there be other signs to go up to tell people the new things, or are you just counting on those bylaw officers to do that work?
Yeah, at this point, I think most of the restrictions are being communicated through other ways. We're not planning another round of signs. We have done some infographics that we're going to be using on social media and through other channels, but we're not going to do another round of signing.
Okay, great. Thank you.
We'll move now to CTV, Josh Pringle.
Thank you very much. My question is for Dr. Etches. How many tests a day are currently being done in Ottawa, and how much capacity is in the system right now for how many tests you could do in a day?
So the test capacities for the region across Champlain region, there are two laboratories that we count on. One is the Eastern Ontario Regional Laboratory Association, ERLA, and the other is the Public Health Ontario Laboratory, the office or the lab that's here in Ottawa. And so between the two of them, they have a capacity to do about 1,900 tests per day. Our testing volume has exceeded that number over the last week at different times, and then at some points it's below. The weekends tend to be a slower point. But on the whole, we think that some of that volume where it exceeded the testing capacity per day was due to long-term care home surveillance. And now that we've concluded that, there's room to continue to take more people. We're encouraging people to present if they have any symptoms, mild symptoms, cough, sore throat, fever. This service is available. And we're also, as I mentioned earlier, thinking about how to continue to prioritize congregate care settings and use that capacity. We're moving ahead with testing in other settings so that we maximize that. Our goal is to use all of the lab capacity that we have to proactively continue the work to identify cases and follow up.
And my follow-up question is, I know you talked about it briefly on Wednesday. The Apple mobility data shows we're getting very close to where we were on March 15th and March 16th. Is there a point where Ottawa Public Health and the city may have to reconsider opening up some of the outdoor areas and reintroduce the restrictions if the data and then the numbers start going back up again?
I think that we have to put all our data sources together to understand if we're getting into territory that is signaling that we are having a rise of infections in our community. So the mobility data definitely shows that we're getting back out there at the highways, like I've heard there's traffic jams, but that alone is not a risk if people are doing that in a smart way. So we can get back to some of the activities, and the smart way to do that is to maintain physical distance and to add that layer of protection of a mask if you're close to somebody else within 2 meters. So then we're also looking at the other numbers. Like the hospitalizations are very solid indicator of the level of infection in our community, whether that's going up or down. They do lag by about a week, so the hospitalizations tend to tell us what was happening with infection about a week or so ago. But that has been stable, and I hope that trend continues. We want to make this kind of information more accessible to the public. So we've been testing out some dashboards, sort of dashboard that will be a monitor of how's it going with the relaxation of the restrictions for the public. I know we have a lot of epi info up, but people want to know the bottom line. Are we red, yellow, green? I think we're yellow. I think that we still have infection in the community. We still have about 17% of our cases where we cannot link them to a known contact or institution or outbreak. So we want to be careful, caution, but we're not in the red territory where we see things heading up into higher rates of infection. So this kind of information we'll be presenting the dashboard as we've got getting a bit more feedback on it, probably early next week, and invite feedback as it's more public from the public, to what's working. Are people getting the information they need to understand the impact of their actions? And it does matter. Each of us, what we do will determine that trajectory.
We'll go now to Craig Lord at Global News.
Hi, I believe this would be a question for Dan Chenier. I know you mentioned, that there's no formal booking for organized sports on any of the amenities that have been opened up. But if we're in situations this weekend where, maybe one family is using a set of basketball nets, what's the protocol for, I guess, waiting your turn? I'm worried that wondering if there might be lineups forming and people kind of gathering to use this equipment. Is that something park ambassadors will help to decide, or is there any kind of system for who gets to use what equipment during the weekend and when everybody's trying to use it all at once?
Many of the tennis courts already have a protocol either posted on the fencing around them, or somewhere nearby, or in a lot of cases in neighborhoods, there is you line up your racket on the bench, or there are different ways of doing it. But there is certainly a role to play for the ambassadors. They will be in the parks, and where they can assist, they will, bearing in mind that there are only 6 teams and they're not in the parks for more than a few hours at each site. By and large, people hopefully will have, as they usually do, the ability to work out a system to take turns. But where the ambassadors can help, they will.
Great. And the other question I had was about people bringing their own, not necessarily equipment, but I'm thinking like lawn chairs, park blankets, that kind of stuff. Is that okay? Are there any precautions around what you should or shouldn't bring if you're physically distancing in a park this weekend?
People can certainly bring things like lawn chairs and blankets and their own sports equipment, balls and those types of things. That has always been permissible, and because it's theirs, hopefully they will be just using it amongst themselves and not sharing it, but there's no issue with bringing that type of equipment.
Okay, great. Thank you very much.
Et maintenant, Julienne Paquette, Le Doigt.
Oui, bonjour Monsieur Chénier. Je serais curieux, en fait, est-ce que c'est possible de nous dresser un peu un genre de liste des limites à l'utilisation des installations sportives? Par exemple, pour une partie de tennis, qu'est-ce qui est possible et qu'est-ce qui est encore interdit?
Ce qui est possible, c'est que on peut jouer en simple ou en double, certainement. Alors, 4 personnes, 2 de chaque côté du filet, respecteraient les normes de la province, que ce soit pas plus que 5 personnes qui servent d'une installation en même temps. La même chose pour le basketball ou pour les terrains de soccer, ainsi de suite. On encourage les gens de participer en petits groupes, mais de ne pas, puis de maintenir leur distance. Alors, vraiment, le chiffre magique, c'est 5. Dans plusieurs sports, c'est plutôt 4 parce que c'est 2 contre 2. Dans ces cas-là, c'est permis pourvu qu'on peut maintenir une distance de 2 mètres. Ce qui n'est pas permis à l'instant, en grande partie, c'est de se servir des installations dans le parc qui est plutôt visé vers les enfants. Alors, les structures de jeu, les balançoires, les glissades, ainsi de suite, tout ça n'est pas ouvert encore, mais en grande partie, le reste est permissible.
Et est-ce qu'il faut absolument que ce soit toutes je perds un peu le fil dans les nouvelles règles, là. Est-ce que il faut que ce soit absolument des gens d'une même maison ou ça peut être deux amis qui se
Je
rejoignent
pense que
pour...
Santé publique dirait que ça serait préférable. Les 5 personnes, c'est toujours préférable que ça soit de la même maison, mais ce n'est pas absolu. Alors, s'il y a 2 voisins qui veulent aller jouer un match de tennis, il n'y a pas de problème. En grande partie, je pense que quand on regarde qui est dans le parc, puis à qui on veut faire une intervention pour discuter des normes, c'est vraiment s'il y a un regroupement de plus de 5 personnes.
Okay.
Elizabeth
Merci
Payne,
beaucoup.
Elizabeth Payne, Ottawa Citizen.
Hi, sorry about that. Yes, thank you. I have a question for Dr. Etches. I've been talking with families who really want to get back in to see their loved ones who they've been caring for in long-term care. And the emergency legislation from the province even allows it actually for family caregivers to be seen as essential visitors, but that's really not happening or very seldom is happening. I'm wondering if you have a comment on this and how you see this should work.
Yes. So this is again something we're working with our healthcare partners to address. The priority for organizations has been to protect the lives, the health and safety of residents. We know that over 90% of the deaths that have occurred due to COVID-19 are in people who are over 70 and the majority in long-term care homes. But the risks need to be balanced. So there's the risk that a family member and I'm comfortable to use the term move away from the term visitor to use the term partner in care. So often these family members are providing care, right? So there's a need to balance the importance of that care that they're providing with the risk that they will introduce infection into a population that's certainly at higher risk. The actions of one family affect the whole long-term care community. There's also the risk to the partner in care who's coming in because they're entering an environment where there could be infection. So it's a matter of balancing all of these risks, and the care that family members provide is important. So this is a conversation with hospitals, long-term care, healthcare partners to figure out how we do this in the safest way possible to reintroduce those partners in care.
Okay, thank you. I have a second question. It's for Dr. Manuel. It's to do with the second wave. You said the second wave isn't necessary, but I'm wondering if you can help me. You've got a model that shows, I think, if I understand it, that even a 20% increase in more contacts would bring a pretty significant wave in September. How is it likely to avoid that when we've got day camps starting, people going back to work, stores reopening?
I think that these will all cause pressure upward. The question is how can we get back and move around without connecting physically? And so that's the challenge for us all, like not public health or not the hospital, like for all businesses and everyone. So that's the challenge. Can we, it was very blunt at the beginning. Everyone stay at home, everyone, and now can we be smarter about it? Can we go to the park and play soccer, but not be physically close? So, it's the challenge. We do the models like that we're showing, or the models that everyone's showing, that we don't have a lot of wiggle room if we're not being smart about that. but I'm trying to move. I'm starting to, and this is where, I think of the media as like you folks as collaborators about how to communicate this, and I'm starting to move away from the term just physical distancing to try to talk about the sort of smart distancing or transmission. We need to break up the transmission. So can we go to a store and not have transmission? And I think these things are possible. I personally think that that we need to think about if we are in a situation where we're having upward pressure and disease circulating, can we do that and still not see hospitalizations increase? And we don't really know, but when I see the low rates of ICU, that says to me that our vulnerable people are maybe getting the message. And when I talk with my patients, older people and people who are vulnerable are even more careful. But we shouldn't put that on the onus on them. A business shouldn't have to ask, are you a vulnerable person? Or you shouldn't, if you're encountering someone, we should create it so that people who are most vulnerable still can participate in safe physical distancing. So, I'm optimistic. I mean, I talk with a lot of epidemiologists that are less optimistic than I am, but I think that we'll respond, and we'll keep a close eye on things. We'll keep a close eye as much as we can at the hospital and Ottawa Public Health and give feedback. And if we're seeing things climb, it's possible, and then we're going to have some more discussions, as a community about what that means and how we're spending this credit that we've earned. So I'll stop there and see if that helps, and I'm happy to continue on answering.
In the interest of time, I'm just going to move to Taylor Blewett from the Ottawa Sun.
Hi. So my first question would be for Dr. Etches. I'm wondering, a group of Shopify volunteers they've developed a COVID-19 contact tracing app. I'm wondering, is that something OPH is looking to utilize in some regard? And also more generally, I know that about a month ago, you talked about ongoing work to develop an app that could be downloaded locally and used for contact tracing, and suggested that, you were pretty close to maybe even having something up and running. So I'm just wondering why, we still haven't seen that locally yet.
That's right. Ottawa Public Health is very interested in digital solutions that can give us, some additional tools to follow up with people quickly, to explore the geographic nature of connections between cases. And so we have been testing out different ideas, evaluating different options for contact tracing apps. What's become clear in the last week or so is that the province and the federal government are also now, sending much stronger signals that this is something that they're interested in launching. And so it makes a lot of sense to use the same tool, the same platform across a country, across a province, because we're so interconnected. The travel between jurisdictions, you want to be able to track and make connections with contacts, that may be beyond Ottawa, obviously. And so our work right now is on pause while we're waiting to see what the province and the federal government advance.
Thanks so much. And a second question on a different topic. I know this was kind of asked earlier, but I just want to return to the idea that we are seeing economic reopening, easing of restrictions happening differently in Ontario and Quebec. As of today, the Quebec government is allowing outdoor gatherings of up to 10 people from as many as 3 different households. Obviously, that is not something that's currently permitted in Ontario. June 1st, they're going to have some personal services open up, hair, nail salons. What would your, message be to Ottawa residents who are weighing the idea of crossing over to Gatineau to take advantage of more services or freedoms that are allowed there? If you could provide I know you got at this earlier saying, continue what you've been doing, prioritize caution and care for others, try to stay physically distant, but is there even more specific instructions you could give on this topic?
So the province of Ontario is looking at what's happening in Ontario, and they have decided we need to go slowly and carefully, given that we still have virus in our communities, and we want time to evaluate each step of relaxing of the restrictions. And we're taking our lead from the province about what specific services may be available or not. Um, it is a unique situation in Ottawa. Of course, we're very connected with our Gatineau neighbors. We're part of the National Capital Region, and the principle is the same. That the more we come into close contact with others, the greater the risk of transmission. We seem to have had higher rates of infection on our side of the river, and so that may have been a bit behind the rationale for the bridges to be closed. And I think we need to be cautious. It's practical advice, I guess. Everyone has responsibility, of course, if we are not feeling well, if we have any symptoms, to stay home. We should not be traveling if we're sick. And then the new message we're emphasizing more and more is it's now your responsibility, if you have symptoms, to also present for testing so that we can make sure we can rule out COVID-19. And so, this sense that we need to do our part and think about whether an activity is essential, I think it is the advice right now.
Thanks so much.
Dr. Watt from Radio-Canada. Est-ce que quelqu'un de Radio-Canada est sur la ligne?
Oui, c'est Gilles
Bonjour.
Taillon qui est là.
Bonjour, Gilles.
Bonjour. Donc, oui, cette question-là des passages d'Ottawa vers Gatineau et vice-versa m'intéresse particulièrement. Hein. Il y a eu les barrages sur les ponts pour empêcher les gens d'Ottawa d'aller vers Gatineau. Dans le même ordre d'idée, les Ottaviens qui vont à Gatineau où les rassemblements permis sont plus grands et qui reviennent ensuite, est-ce qu'ils représentent un risque pour Ottawa?
Notre partenaire à Gatineau en santé publique partageait leur information avec nous qu'ils ont moins d'éclosions et un nombre de cas plus bas qu'ici. Alors, le risque de transmission de COVID-19 est peut-être moins à Gatineau. Mais la situation est en une période de changement parce qu'ils ont commencé avec les écoles, d'autres activités, et c'est possible d'augmenter le nombre des infections dans la communauté avec les activités comme ça. Alors, on a besoin de faire la surveillance ensemble et partager notre information. C'est notre méthode de travailler. On a des réunions régulières et on va communiquer aussi avec le public si le risque augmente.
Alors, M. Chénier a parlé tantôt là, du type d'utilisation des parcs. Là. Je voudrais savoir comment les autorités gèrent les rassemblements extérieurs. Et j'aimerais aussi savoir pourquoi Santé publique Ottawa ne fait pas la même chose que le Bureau de santé de l'Est de l'Ontario par rapport aux cas de COVID-19 qui sont rapportés dans les épiceries des autres commerces, c'est-à-dire de publier des communiqués avec les détails sur les cas. Aussi Transpo le fait, pourquoi pas Santé publique Ottawa?
OK, d'accord. J'ai compris la deuxième partie de votre question. Je peux répondre. Et je pense que la première partie, c'est concernant les parcs. Je ne sais pas si c'est une question pour M. Chanier.
Oui.
OK. Mais Santé publique Ottawa partage beaucoup d'informations concernant les éclosions sur notre site web. Mais on partage l'information concernant une spécifique entreprise s'il y a une raison de partager cette information. Parce que souvent dans une entreprise, on a la capacité de faire le suivi avec tous les employés, tous les clients qui étaient à risque. Alors, on va partager l'information s'il y a une entreprise ou un grand nombre de la public à risque, on peut annoncer ça. Mais dans notre expérience, 7 points, avec les éclosions dans une édifice, par exemple, c'était possible de faire le suivi avec les contacts sans un avis pour la public.
D'accord. Et M. Chénier, s'il vous plaît, sur comment vous faites pour gérer les rassemblements extérieurs? Vous avez dit oui, c'est interdit pour certaines choses, c'est permis pour autre chose, mais comment vous faites là pour gérer tout ça?
Alors, il y a deux approches à cette problématique-là. Premièrement, le service des règlements font des patrouilles régulières. Je pense que j'ai mentionné au début qu'il y a à peu près 200 visites par jour dans les parcs d'une façon proactive pour regarder qu'est-ce qui se passe, puis de rappeler aux gens que plus que 5 ou bien de se servir de certains des équipements n'est pas permis à l'instant. On a aussi nos 6 équipes d'ambassadeurs qui sont du personnel des loisirs, des groupes de 2 qui se promènent dans les parcs, entre 35 et 40 parcs par jour qu'on visite. Et encore, on rappelle aux gens, puis les 2 choses qu'on a cause à leur rappeler le plus, c'est de se distancer des autres, puis de se tenir en petits groupes, mais aussi souvent de ne pas se servir des aires de jeu qui ne sont pas encore permis. Alors, il y a 2 équipes, le service des règlements qui font ces rappels-là, mais aussi les ambassadeurs qui vont parler aux gens, puis leur donner des suggestions de comment se servir du parc sans contrevenir les autres provinciales.
Donc, très bien. Merci beaucoup, Dr. Etches. Merci beaucoup, M. Chénier. Merci tout le monde.
And the final question will go to Patrick Ugochiani of your community voice.
Yes, my question is for Dr. Etches. With you expanding the testing, is there any consideration given to home testing for those people that, are reluctant to get out and go to one of the clinics or the testing centers? Is it like maybe a public health nurse or something? Is there any consideration given to that?
Yes, we have been providing service for people who are not able to get out to a testing center. When I say we, I mean the healthcare system as a whole. We work under the organization of the Champlain Health Incident Command structure. And different parties have helped with that. So there's been the inner city health mobile van that can go to some places where people live, where they may not be able to get out. There's also been the paramedics, community paramedic program, where they've been able to go into people's homes, such as a long-term care home, where people may have more difficulty to get out. So these are all things we're looking at how to expand and create different opportunities for people to access testing across the community. Again, starting with your family physician's office, that may be a possibility for some. I don't want to get ahead of myself and the partners that we're working with in terms of announcing some other things in the works, but this is something we see as desirable, given that not everyone is coming to the assessment centers. But again, please invite your support, getting the message out that we're looking here for a change, not just to stay home when you have a cold, but to go make sure this isn't COVID. And we appreciate your help getting that message out.
And my second question was for Dan Chenier, if he's still on the line.
I'm still here, Pat. Go ahead.
Dan, I know you haven't made the decision yet about summer camps, and I'm sure you're getting sort of close to a drop dead date. How are you holding on to these summer camp employees if you're having to wait so late? Could they maybe be going on to other jobs, or with the 4,000 people that are being laid off, would they be a source of these summer camp employees? Should you actually go ahead with it?
It is a challenging situation, Pat. We are looking for, as soon as possible, clarity from the province in terms of what we can operate in and what the conditions will be. We expect that the conditions will be greater than they were before in terms of size of groups and the precautions that we have to take. We're not holding on to staff. Our summer recruitment was held earlier in the year, so we have several thousand people that have shown interest in working for the city in the summer. We have not hired them yet. We're waiting. We're also mindful, though, that not all of our services will be back up and running this summer, and that we will have, much like we did with the park ambassadors, some capacity, if we need to redirect some of our full-time resources to help coordinate and run those summer camps. So we are still hopeful. We have plans in place to move quickly if that happens. Some of the 4,000 people that were put on emergency declared leave back in March are still our employees, are ready to come back, and a lot of them worked in programs like our after-school child supervision program, and so they're already trained, they're all ready to go, and often, even in past years, they become our summer camp employees. So we're still in good shape, I believe, to deliver a good product and to be able to comply with provincial directives, whatever they might be. But sooner rather than later would be great to get some clear definition on those things.
Thank you.
That's it for today. Thank you very much. Merci beaucoup et bonne fin de semaine.